1440 KVON 99.3 The Vine. This is Kelly. Good morning. It is time for Healthy Communities with St. Helena Hospital. And I have two doctors in here with me this morning. I was just explaining to them how cool that is. I have Dr. Ethan Schram and Dr. Stephen Banks. And this morning, the topic, Martin O'Neill Cancer Center and all that they have to offer and what you do there. And welcome, gentlemen. It's great to have you here.
Good morning, Kelly. Thank you.
So let's see. Shall we start with Dr. Schram? I have here to talk a little bit about what you do and what's available at the Cancer Center.
Well, I'm a medical oncologist, which means I don't do surgery and I don't do radiation. I deliver chemotherapy, usually by vein or by mouth. Our Cancer Center offers something pretty unique in the North Bay. What we generally do, what we have is a lot of clinical trials, which usually are something that's offered only in large academic centers. So we have access to a lot of cutting-edge treatments that you can only get in places like Stanford or UCSF. And in fact, we have an affiliation with UCSF that helps us make those trials available to people here in the North Bay.
Oh, that's wonderful. And so talk to us about, I see you have a clinical care navigator. What is that?
A clinical care navigator is, in our case, a woman named Colleen Winters, and she is a social worker and works essentially to tie together the picture of a patient's health and their family history, and is actually able to make it easier for families and patients to get the care they need and with special needs they may have.
So it's kind of seeing the big picture.
She puts the big picture together, absolutely.
Oh, that's amazing. And then cancer risk assessments and genetic testing. Is that for someone who maybe doesn't have cancer or doesn't know if they have cancer to just get tested?
Correct. Or may have a family history of cancer if they have some concerns.
Okay.
And a lot of times somebody may come in with cancer at a young age or an advanced age and report a family history, and they may want to have family members tested as well to see if family members are at risk as well.
So genetic, so that cancer can be genetic.
Cancer
I don't think I realized that.
Yeah, cancer can be genetic. Depending on what type of cancer we're talking about.
I see.
Hereditary cancers account for 5 to 10% of cancers. The rest are probably sporadic, but there are some cancers that we find at a young age, and it makes sense to have family members tested, and we offer that service.
So that would the genetic markers mean that there's a predisposition or your chances are higher, not that you necessarily are for sure going to get it?
Correct. It increases certain chances, and there's certain things we can pull out of a family history or using markers give a ballpark estimate of what somebody's chances are of developing a cancer. And fortunately, we have some screening techniques and some preventative strategies to help people prevent actually developing a cancer.
Wow. Okay, and that leads into my next question. You have an oncology certified registered dietitian. We do. Because that's important, right?
Absolutely. Every patient we have at Martin O'Neill gets to see our dietitian, and nutrition is a key part of our treatment strategy. And it's something we offer that a lot of other places don't offer. So nutrition is important in terms of preventing future cancers and also managing the treatment side effects and staying healthy through your treatment.
Gosh, we could probably do a whole show on that.
Absolutely.
Coming back, talking about the nutrition preventative and helping someone who already is going through the treatment. And then what's a patient experience team?
Patient experience team is something we have. It's one of those intangibles where any patient who comes in, basically everyone on our team, from the nurses to the dietitian to the doctors, everyone knows every patient's name, and it's really something we talk about at each of our weekly meetings. We really get into our patients' backstories and their social situations, and are able to deliver the care that they need. Some people need a lot of care, some people need less, and the experience team is something that I think distinguishes us from a lot of places.
Yeah. I'd agree. It sort of starts with the people who work at our front desk answering the phones, Every patient who walks in the door gets to meet Marjorie, and she really gets to know them. And at the end of a course of treatment, we'll provide a custom sort of personalized gift to that person to say thank you for putting your trust in us and letting us help to take care of you.
I have to say that's not real prevalent in my experience.
No, she's sort of a clinic mom.
She is. She's fantastic.
But that's really nice, and that's so important when you're going through something like this and the family.
It continues on into our resource librarian, Pam, who's there, who does a fantastic job as well, helping guide patients into research that they may want to do themselves at the Cancer Center.
That's nice too. And here's something I really like: complementary medicine, acupuncture, movement therapy.
Absolutely, we have massage therapists. So, you'll oftentimes, if you're walking through our treatment, our infusion room, seeing patients in chemo chairs, actually receiving massages or getting acupuncture, and so it's really a holistic approach to medicine, both Western and more traditionally Eastern medicine.
Right. We've also just recently instituted some trials with movement therapy as well as music therapy. We've had a woman who comes in and plays the harp in the waiting area. I've got to tell you, it's just a magical feeling when she's there.
It's calming, right? You come in nervous and anxious.
And then outside of the Cancer Center, there is the Healing Garden, which is a beautiful respite area with redwood trees and a nice water feature that cascades down a hillside into a koi pond and some tables for patients to sit and relax.
And that's important too. You're treating the whole person, is what I'm hearing.
Absolutely.
With compassionate, good medical care, but you also have the compassion part of it and just and helping with their spirit too.
Correct.
Yes,
correct.
We forgot about pet therapy.
That's right too. We do. We have a therapy dog who comes by and visits on a weekly basis at least as well.
That is wonderful. Dr. Stephen Banks also with us this morning. Tell us a little bit about what you do.
So I'm a radiation oncologist. So whereas Dr. Schram provides chemotherapy and other systemic whole body treatments, I'm a radiation oncologist and provide radiation therapy, which is a more targeted therapy, essentially aiming at tumors or areas of disease or concerning areas that may harbor disease to try and treat specific areas of concern.
Now, when you were on the show before, we talked a little bit about the Calypso machine. I was blown away by that. So tell us about that.
The Calypso, or GPS for the body, is a unique feature that we have at the Martin O'Neill Cancer Center. It was installed in August. And it really has been a fantastic addition. We've now treated about 20 men on the Calypso system for prostate cancer specifically. We've had patients come as far away from Mendocino, Willits, and Lodi, all who have come and actually decided to get treatment at Martin O'Neill Cancer Center because of Calypso. And not to mention a lot of local patients as well. So it's really been a great addition, and I've been very happy with how it's working for patients. We're hoping that by the end of this year it will have been expanded its use outside of just prostate cancer to include lung cancers and possibly some intra-abdominal or breast cancer features that may become approved and useful as well. So we're very happy with how it's working. Along the lines of prostate cancer, the Calypso is also potentially going to allow us to move into a new treatment approach for prostate cancer, what's called stereotactic body radiation therapy. And we talked, I think, a little bit about that last time that I was here as well. Stereotactic body radiation therapy is something that we've used since about August or September at the Cancer Center, and it's a more focused, targeted form of radiation. Gives a very intense treatment course in maybe 3 to 5 treatments as opposed to 30 to 40 treatments.
Wow.
And is being investigated and evaluated for prostate cancer, and there's now finally some long-term data showing safety and efficacy with that treatment approach. What we're looking at is maybe being able to use the Calypso system along with stereotactic body radiation therapy, and we're evaluating some clinical trials to try and get involved with that here. So.
Now, if I remember what you were saying last time about Calypso, it allows you to better target exactly where that cancer is.
Absolutely. We put in little beacon transponders that act as a GPS type of a locator to help us see exactly where that tumor is and exactly where it may be moving during the time that radiation is being delivered. So typical radiation treatment may take 20 to 25 minutes, and the prostate has potential for motion during that period of time based on gas in the rectum or filling of the bladder, things along those lines, and even just with respiration or breathing. So the Calypso allows us to monitor that possible motion and correct for it. And it's the only system really that has that potential to do that in real time. Excuse me, that's going to become that much more important if we start looking at stereotactic body radiation therapy. In that situation, the treatment may take as long as an hour to deliver, and so there's a lot greater potential for motion of the prostate. And with the stereotactic body radiation, since you're giving such a high dose of radiation in such a short period of time, you really don't want to miss, because the potential for harm to normal healthy tissues like the rectum or the bladder is really excessive. So using the Calypso system may give us a real benefit, and our patients a real benefit, to help reduce their risk of side effects and improve the efficacy of that stereotactic treatment.
And I see that there are a couple of things that people can get involved with. One, there's some current clinical trials open for patients, and you also have a symposium coming up that's open to the public. Tell us about those two opportunities.
As far as clinical trials relating to radiation therapy, we currently have clinical trials open for patients with head and neck cancers, which include cancers in the mouth or throat. We also have trials open for lung cancer and then prostate cancer, all that include radiation treatment. And we're looking at possibly expanding into other types of areas, pancreatic cancer, esophageal cancer, and it really depends there on whether there's a need for that service in this geographic area. As far as the symposium that we mentioned, we're very excited about that option. That's going to take place this Thursday from noon to 1:30, and it's open to the public, free of charge, and involves lunch. It's going to be at the Villaggio Inn and Spa, and we're very excited that Peter Carroll, one of the internationally known experts in prostate cancer down at UCSF, has agreed to come, and he'll be discussing and presenting early stage prostate cancer, some prostate screening issues, because that's an area of controversy now. And so we're looking forward to having him talk. I will be discussing and presenting new techniques and approaches for managing men with high-risk prostate cancer, because that often falls into a radiation oncology approach. And then Dr. Harstark is a medical oncologist at UCSF, and she's an expert in urologic cancers as well, and she'll be coming up to discuss management of patients with advanced prostate cancer, patients whose cancers may have already metastasized or spread, and talking about all the new exciting developments that have occurred there.
Well, that's great. So tell us how we can get hold of you, Dr. Banks or Dr. Schram, or get more information on any of the things we talked about today.
Well, for the symposium, I would recommend that patients call Pam Turner, and that phone number would be 707-967-5750 to RSVP. That way we can get a correct head count for space and also for lunches that will be provided. As far as general contact for patients who may be interested in finding out more information on this or coming to see us for evaluation, calling the Cancer Center at 707-967-5721, or have your referring physician contact us. Either way, we'd be happy to talk with either of you. And then the website for the Martin O'Neill Cancer Center can be accessed through the sthelena.hospitals.org website, and find out more information about all the things that we've discussed here.
Great. Well, thank you both so much for being with us this morning.
You're welcome.
And that's Healthy Communities, brought to you by St. Helena Hospital.
This is a Sacramento International Airport travel advisory.